So we have the NUTRIVENTION study that's open at Memorial Sloan Kettering Cancer Center that opened in June 2021. We've enrolled over half so far. It's a 20-patient study with patients with MGUS and smoldering myeloma with a BMI over 25. We're giving patients a whole food plant-based diet. We're actually shipping them meals from Plantable, a company, and we provide them with health coaching for 6 months as well to make lifestyle changes. We follow them for a year on the study, and we're looking at changes in inflammation, insulin resistance, and also myeloma markers and the microbiome. So that study, I think, might finish later this year, but it's also actively enrolling. So if you're interested, that would be a good study. The next study I would talk about is NUTRIVENTION 2. That's actually with the HealthTree Foundation, and so I'm quite excited about it, where we are going to do a study for 100 smoldering myeloma patients. We're going to randomize patients into 4 groups. The first group gets a plant-based diet. The second group gets omega-3 supplements. The third group probiotics, and the fourth curcumin supplements. And there'll be 25 patients in each group. And patients can be anywhere in the country. They don't have to come to MSK. They can be at home and do the study because it's a telehealth study. All that they have to do is fill out questionnaires and do video visits. And then they will be shipping us stool samples to MSK in New York, and we'll send them kits out. So that study is a very short study. The intervention period is only 2 weeks, and the patients are followed on the study for about 2 months. So a very simple study, but it's going to open later this year. And we're interested in having patients if they're wanting to take part in that. The NUTRIVENTION 3 study is a study is a little more involved. It's similar to the NUTRIVENTION 1 study, where patients are going to get a diet versus supplements versus placebo. The diet is, again, a plant-based diet for 3 months through Plantable and 6 months of health coaching. In the second arm, the supplement arm, patients will get omega-3 and curcumin supplements for 6 months. And in the last 3 months, they'll also get the diet. So, we're going to see the effect of diet and supplements versus supplements alone as well. And then the placebo arm will get placebo supplements for 6 months, but they will also get the diet at the end of it. So everybody gets the diet at some point, and some patients get the supplement in the study. So this study will open in June, and it's going to open at Memorial Sloan Kettering in New York, but also probably in Atlanta at Emory, and we may consider other sites. So that study, it is very similar to the first study, but it gives an opportunity for patients to really make lifestyle changes because we're following them closely. And this is any patient with MGUS or smoldering myeloma with any body weight or any BMI who's interested. And then the last study, the NUTRIVENTION 4 study, is actually patients with myeloma in the survivorship space. So patients who've had myeloma and are on maintenance therapy. We have a study ongoing at MSK, which is looking at quality of life with daratumumab versus lenalidomide. This is a 100-patient study that's currently ongoing. 50 patients get daratumumab and 50 lenalidomide. It's a randomized maintenance study. So this is patients who finished induction therapy plus minus transplant, achieved a very good partial response, and then are on maintenance therapy. That they can go on this study. While they're on the study at cycle 13 or cycle 25, so 1 or 2 years into the study, we will offer them the opportunity to get 3 months of a dietary intervention of a whole food plant-based diet from Plantable, and we will check microbiome changes and immune changes before and after, and we'll be providing all of this. And it's an optional nutrition study to patients already on the daratumumab versus lenalidomide study. The other 3 studies, patients would need to come to MSK to drop off either blood. They will have blood tests at MSK and bone marrow biopsies or things like that. So the studies require a bone marrow biopsy at baseline and then at 1 year time point. And they also have a scan at baseline and 1 year just to make sure that there's no active myeloma. And the same thing with the blood test. There are about 6 time points or so across the whole year that patients would need to come. So Other than that, they can be anywhere in the country, but they would need to come about maybe 6 times in a year to New York or Emory if it's there.